Hello everyone, welcome back to Be Rich. Today we're going to talk about
Healthcare.
crippling healthcare. Why countries, forget India, I'm talking about world over, developed countries who are the pinnacle of today's civilization. Why are they not able to get their act together and coming to healthcare, Anand? What's
And
happening?
and it's not a problem only in Europe.
Yes.
It's a problem even in Canada, which is health care is supposed to be very good.
Yes, all over Europe,
And there's a
Switzerland.
problem in Switzerland.
Yes.
US problem is so documented, so we won't talk about US.
Yes.
Okay, US is
Thomas
terrible.
More in 1550 said hospitals and healthcare are going to be something of utopia. The people will
He
not
wrote
want,
in Utopia.
yeah, in Utopia he wrote that people will not want to die in homes and be sick at homes anymore because hospitals have such great equipment and such lovely nurses and doctors. Everybody would rather be in a hospital than be at home. 500 years on, we're still stuck at the lobby.
No, I'll tell you what is the problem. The problem came, I think, after World War II, when they tried to nationalize everything. So England and Europe have a national health scheme,
Correct.
but the state spends money. Now the state has not increased the budget. It requires a lot of money. NHS needs doctors,
Yes.
and the doctors have to be paid money.
Yes.
And private care, medical care is extremely expensive. It cannot be afforded by many.
Very true.
And there are not enough nurses and doctors because Mr. Sunak doesn't believe in
Correct.
paying them
The wages.
the wages, and then the facilities. And what has happened is the money that you deduct for national pension scheme, national health scheme, is not enough to fund this.
No.
The state does not have enough money.
True.
This is the fundamental problem. My friend in England told me, if you go with toothache, he says this is not emergency, come after 3 years, 3 months. A guy who's got an accident with bruises, they give him aspirin and send him home. Unheard of in India.
Agreed. In developing countries, it's not so bad.
Yeah, otherwise you have to go for private care. People with bypass surgeries are told to wait because it's not important and it's not urgent. Imagine the mental state of people. This is because they simply don't have money. Why don't they have money? Because all of Europe has aged very fast. So the amount of money that is required to treat them has gone up. So as a percentage of GDP, healthcare cannot be constant. Healthcare has been constant in a rising GDP. But what should have happened is as people aged, as a percentage of as a percent of GDP, healthcare should be much higher.
Very true.
Okay. The estimate is today for Europe at their age group, it should be 15 to 20% of GDP.
True.
And you have to allow migrants to come freely.
That's the only way you can keep your cheap
System
labor.
going.
Yes.
Yes. Now there is a big
Because
demand.
migrant doctors and nurses won't be
See,
in
in
mind.
Tamil Nadu, from Tamil Nadu, there's a huge demand for British nurses, for nurses in Britain and Ireland. They are given immediate passes if you pass exams.
Their standard exams. Yes.
They have standard exams. There are coaching centers where you pass and you can go straight forward. At the pay that which NHS pays, only these guys are willing to work.
True.
The others are not willing to work.
No.
And there are stories of people sitting in the lobby after getting a heart attack for 90 minutes. Now, is this because of COVID? No, it's not because of COVID.
This
Okay?
has been pre-existing.
Because this was before COVID. COVID has it made it worse. Is because what has happened is during COVID, people with other conditions were not treated.
No.
So they were asked to go home.
Yes.
Now they are coming back to get treated for the same disease at a later stage.
The waiting line has increased.
Waiting line has increased. And because they had good vaccination, people had not suffered flu and other diseases for a long time.
Correct.
But after COVID, everybody is getting flu.
Yes.
So death percentages have gone up by a quarter.
Correct.
And healthcare is buckling under pressure. And the private sector, nobody has money to pay for the private sector. So they don't know how to fix it. Switzerland has the best system, where everybody was praising Switzerland. Even Switzerland is struggling.
True. Problem in the private sector is also a lot of money now is chasing the few services available. So inflation is spiraling there
Yeah.
also. Where private companies are saying,
So there are some Indian hospitals which act as tourism.
correct.
For some of the diseases, people come and opt to get treated in India. But what is happening is the US NHS does not, UK NHS does not pay for
Indian services
Indian services, and the American insurance is not paying
for outside services.
outside services. Now, if the US insurance pays for Indian services, you'll have more US patients coming here, getting treated, staying in a five-star hotel, and going back at one-fourth the rate. This is why this Narayana Hridayalaya chap, no, he wanted to build it on islands near Cayman Islands, a facility where Americans will come and get treated at lower cost. So there is a huge cost problem. The societies are aging. They don't have enough nurses and
Yes,
doctors.
I
And
do
they,
agree with you on this because I saw a statistic. Life expectancy for an average American in 1900s was 49 years. Today it's almost 80 years. So an average American is expected to live to the age of 80 compared to at 100 years ago
yeah,
it being only 50.
yeah.
So this is a tremendous problem.
No, but the issue is not only that. This age is coming down because of drug and gun violence. So the daylight, if you separate it by class,
Correct. The poor and the rich.
the poor and the rich, the poor will die by 58, 60. The rich will be at 83,
Because of
84
social circumstances.
because of social circumstances in US. So they have a huge problem, and the GDP is declining in recession. So taxes as a percentage of revenue is coming down. So they have to crimp on payments for everything. So they are going to crimp this also.
So this is leading, adding more fuel and fodder to the social unrest. which is happening.
Yes.
So what is the solution to all this? Because you're saying it's just not a question of spending more money. It's a little too late.
See, they need to do two things. They need to allow large scale migration of medical facilities,
Doctors and nurses.
or what they can do is you can have a government to government tie up with a country like India, Sri Lanka, and all that, and send your patient. The surgery requires the highly costlier portions, which require more than 1 month of or 15 days of hospitalization. They
Yeah,
can
but
be
in
sent.
US it's always very famous for the doctor didn't treat me right and putting a case on him.
That is
Malpractice
private.
case. No, that is malpractice.
That is
But if you
private.
do this India thing, these guys will say we cannot put malpractice in India, no?
There is private insurance. I am talking of NHS tying up with government, with private hospitals here. I am talking the solution is for Europeans.
Because they'll say our standards are not up to their standards.
Yeah, but you are in a hurry. You don't, like in Madras, somebody who is known to me is seriously ill. And if he has insurance, can be admitted to a hospital today.
Correct.
You don't
I
have
agree.
to wait.
Totally agree. But for everything, Europeans have a standard certification. They have a European Union which is a list, and you have to do punch list and tick off on all these things.
The only solution is
Even their vegetables are graded.
yeah, okay. The only solution for them is to allow more tourism into India, Sri Lanka,
Medical
and
tourism.
medical tourism.
Where they are willing to pay the cost of their patients.
Yes, so you have outsourced software, right?
Yes. So outsource
You can outsource medical care.
seems like a good solution.
Yeah, it is a good solution. Thank you for watching, Biraj. If you like this video, hit the like button for this video and subscribe to our channel. Turn on the bell notification, otherwise you will not be notified every time we put out a video. Once again, I thank you for your support to Biraj. It's a great privilege and honor that so many of you in thousands have subscribed to my channel and have supported me. I have written 2 books in English, The Alchemy of Money and Ordinary Stocks, Extraordinary Profits. These books are published by us and are ready. If you want to procure a copy, send us a message to the WhatsApp number given below and my team would respond to you. If you want an Amazon Kindle copy, you can click the link below. Finally, those who wish to consult with me can send a mail to brechenglish@gmail.com. Once again, I thank you for your support. If you like this video, press the subscribe button of my channel, hit the like button and turn on the bell notification.